Thank you, Mr. Chairman. Members, less than a year ago, Democrats and Republicans came together to pass the Medicare Access and Children's Health Insurance Reauthorization Act. This was the big SGR repeal, but it also set policy for the Children's Health Insurance Program, known as SCHIP, and a higher matching rate for states through 2019. This was terrific news. It was an important bipartisan effort. I believe it was probably almost unanimously supported by members in this committee. And it was terrific news because it meant that more children in America will get health coverage they need to succeed. It was also good news for the taxpayers, as research shows that investing in health coverage for children provides a strong long-term return because children grow up healthier, better educated, and more economically successful as adults. And despite all the acrimony over health policy over the past few years, whether it's up here in Congress or at the state level over Medicaid expansion, this was a great example of Democrats and Republicans coming together, feds and states coming together to take care of kids, to ensure that they can see a doctor. So I have to say, we were very taken aback that Republicans would propose to renege on the agreement in the legislation that was adopted last year, to the detriment of children across this country. This Republican bill, which really appeared out of the blue, probably at the insistence of the Tea Party members, that's what it appears, that's what folks are saying, but this Republican bill will pull the rug out from under children, families, and states who you made a commitment to just last year. You know, states have relied on this policy, on this new law, and made a commitment to expand and improve children's health benefits. This is no way to chart important policy relating to children's health policy, and it's no way to treat America's kids. This Republican bill will be especially disruptive as states are already 3/4 of their way through this fiscal year. Many have already considered their upcoming 2017 budgets. In the state of Florida, our legislative session ended last Friday. They have relied on the commitment that we made through MACRA and the CHIP reauthorization, and in doing so, they said we are going to improve health benefits for children in Florida, and other states are going through the same exercise. So my amendment says that this section of the bill related to the CHIP reauthorization cannot take effect unless and until HHS certifies that there's no impact to children currently covered by CHIP, and it cannot impact current state plans. If you oppose the amendment, you're supporting a significant ratcheting back on children's health insurance, and you are saying you are breaking the commitment you made last year as part of that very important MACRA bill. So I urge my Republican colleagues, especially those of you who supported the Children's Health Insurance reauthorization last year, not to turn your back on kids that need to get to the doctor's office. Support this amendment, vote yes on this amendment, and I'm happy to yield back my time.